Hello, my name is Associate Professor Catherine Granger, and I am an Associate Professor of Physiotherapy at the University of Melbourne within the Department of Physiotherapy, and also a physiotherapist at the Royal Melbourne Hospital in Melbourne, Australia. I'm delighted to be talking to you today as a previous Tall Poppy winner in the state of Victoria a couple of years ago. I've been asked to talk to you a little bit about my career pathway to where I am today, and also a little bit about my research and what I focus on. So as I mentioned, I'm a physiotherapist by background. I graduated as a physiotherapist many years ago now. I went from the traditional pathway from high school in VCE in Melbourne to a Bachelor of Physiotherapy program, the 4-year program, and then I graduated as a clinical physiotherapist. That was back in 2005. And then I worked for many years in the hospitals in Melbourne as a physiotherapist. And my role at that time was working with people with a range of conditions while they're in hospital, helping them with their rehabilitation needs and their recovery needs, and helping them recover from the illness that had brought them into hospital. Now, after many years working in the clinical area, I became interested in conducting research. I had used many research papers to inform the practice that I was doing as a physiotherapist, but I also became interested in conducting some of our own research to further understand how we could make a difference for these patients in hospital. So particularly looking at research to understand what type of physio treatments would be effective, what type of exercise programs might be effective, and how we can best serve the patients that we work with. So I then went down a pathway of doing a PhD within the physiotherapy, and subsequently coming out of my PhD, I've now taken a focus more on research and academia. And whilst I still work in the hospitals, as I mentioned, I work at Royal Melbourne Hospital, I'm now very much focused on leading and conducting research, as well as training the next generation of researchers. So I have a group of PhD students, for example, that are physiotherapists now, focusing on doing research as well. We're all looking at ways that we can help get better outcomes for our patients. My research is particularly focused around the role of exercise for people with cancer. And a lot of the studies that I do include people who have been diagnosed with lung cancer. Lung cancer is a terrible condition. It's very commonly diagnosed in Australia around the world. And it's a condition that's associated with significant symptoms. So people often have problems such as shortness of breath or fatigue or cough. So it can be really troubling for the person diagnosed with lung cancer. So my research over the last decade and the work that I'm working on right now is looking at the way we can utilise exercise and rehabilitation to help people with their recovery and also to get through treatment for lung cancer. What we're looking at is how we can help people exercise before surgery. So for example, someone might be scheduled to have surgery for their lung cancer. We're looking at how we could use exercise before that time point to get them fit for surgery. And we're also looking at how we can use exercise after treatment. So for example, after someone's had their surgery, they've gone back home after hospital, what can we do then to help them speed up their recovery, to help them get back to doing what they want to be doing, back fit and well as much as we possibly can. So a lot of our work is around understanding the role of exercise, understanding how to best utilise it, how to get the best out of the exercise programs for our patients. And on a day-to-day basis, I spend much of my work doing that research, also supporting the team that work with me to conduct that research. What I love about my job is that I work with many different people. I meet many people from all over the world who are either patients who have had lung cancer, who are clinical staff working day to day with people with cancer and other conditions, and then also academics and researchers who are working on answering these really important questions to ultimately change clinical practice to help improve patient outcomes. So I meet many people, I work with big teams, and we all have one common goal, and that's to improve the quality of care and outcomes for people diagnosed with these conditions. It's exciting, it's rewarding, that there's huge potential here. We can really make a difference, and it's a wonderful job. So for all of those, particularly those students out there in year 10, 11 or 12, looking at what careers you might like to do, keep in mind something in healthcare, even if you're interested in science and research. I was originally really interested in science and also sports and exercise, and that's where physiotherapy for me was a perfect match. I love being a physiotherapist. I'll be a physiotherapist for my whole career. It's perfect for me. But I love the combination of the science in physiotherapy and the way we can do research as well. So wishing all of the students out there best of luck in your careers and your planning and your goals and aspirations. Keep physiotherapy in mind, and looking forward to following your careers in the future. All the best, and thank you.